Namaste. My name is Sharath. My father's name is Surya Narayan Rao Garu. He is a resident of Kakinada. In 2019, he had some ear pain and he consulted a doctor locally in Kakinada. The doctor, during the treatment, he kind of spotted something on the tongue and he wanted an expert opinion. So the next day he came to Hyderabad and we came down to Yashoda. So we were not very sure about what the problem is because the doctor didn't say much at Kakinada. So we went to Dr. Shastri Garu, who is the ENT specialist in Yashoda. So he revealed that it is potentially canceric growth on his tongue. So immediately I ordered a biopsy, and as soon as biopsy results have come, it was confirmed that it has some cancerous growth which need to be removed. So he referred us to oncology expert, Dr. Srikanth Garu. So Dr. Srikanth Garu has taken over the case from then on and then has helped us with the diagnosis. He has explained that because it's in the non-critical organ, it is curable, can be amputated, and surgery will more or less will fix the problem, is what he has advised us. We were a little nervous, primarily because my father is a very delicate man and we were not very sure whether he would withstand a surgery. So he has given us all the support and explained us proceedings in terms of how surgery would happen, how much time it would take. I think he was very helpful, very close, and he explained the proceedings so that we were a little comforted. We went through definitely nervous moments during that period. Even post-surgery, we had to have him in the hospital for a duration of a week or more. So he had certain slight complications. It's not necessarily physical complications, but it probably the post trauma of the surgery. During that period, again, Dr. Srikanth Garu and Dr. Raghutam Reddy Garu, who have been with us through the journey, has helped him come back to the normalcy. So that was a phase, I think, forgettable but unforgettable in a sense that the support we received from Yashoda, the staff, the doctors, the treatment, the quality of treatment, unparalleled, I would say. So today, my father is almost 4 years after the surgery and he's in perfect health right now. We come to Yashoda, we continued the same consultancy with Yashoda, even though he's from Kakinada. He keeps traveling every 3 months to make sure he consults with the doctors, experts, and ensures his health is normal, no additional complications. I would like to thank Yashoda team, Dr. Srikanth Garu in particular, his team of experts, Dr. Nived and team, and Dr. Raghutam Reddy Garu for helping my doctor come back to the normalcy and good health.
Hi, this is Dr. K. Srikanth, Senior Surgical Oncologist, Yashoda Hospital, Samajiguda, Hyderabad. This is regarding the patient, Mr. Surya Narayana, who has come from Kakinada for carcinoma of the tongue. So particularly this patient is such a frail patient. His weight is about, I think, 42 or 44 kgs, a very low BMI for this height, and very frail patient. He had no addictions like tobacco chewing or whatever it is. So he came to us with a ulcer in the left lateral border of the tongue, which infiltrating the deep tongue muscles and the floor of the mouth. He had ankyloglossia as well. So basically it was a slightly advanced disease with the neck nodes also. So looking at his profile and at the disease status, we had to go for the surgery because he was not in a condition to withstand any neoadjuvant therapy like chemo or radiation. So we thought we will go ahead with surgery primarily, but because of his frail condition and one or two comorbidities, what he had, diabetes and old history of some CVA, we had to be very cautious in his surgical thing. We took him up for surgery, which we did a left composite resection with free flap because we had to remove his jawbone also, as it was infiltrating the mandible as well, the jawbone. So we had to remove the left part of the jawbone, part of his tongue and the floor of the mouth and the deep extrinsic muscles of the tongue, and then did a neck dissection as well on the left side, where we had to remove the neck nodes on the left side, the level 1, level 2, level 3 and level 4 lymph nodes, and we had to put a flap from the thigh on the left side. We did a free flap, free microvascular transfer of the flap, and microvascular anastomosis was done because that will give him a good cosmesis and also a good reconstructive thing for the patient with good mobility of part of his remaining tongue. So that's why we chose that option. Everything went off well. Post-operatively, he had some issues because of his old CVA. He had to be in the ICU on ventilatory support for some time. But fortunately, and because we have a very good team support from the pulmonologist, from the intensivist, from the anesthetist, and from the respiratory therapist, So all of us really were a team on him, struggled to bring him out of his post-operative stormy phase. Ultimately, I think mostly by about 7th day or 8th day, we could discharge him. 9th day, we had to do a tracheostomy also for him because of his respiratory issues. Everything went off well, and by 2 weeks on 12th day or 13th day, we weaned him off his tracheostomy, and then we removed his tracheostomy tube as well, and then started him orally on 12th to 14 days before we removed the Riles tube also. So as of now, 4 years post-op, he's doing good. We did think of post-operative radiation, but considering his condition, though the histopathology report demanded adjuvant radiation, we didn't give him because of his condition, and the patients also were not very keen of the radiation. Surgery wise, only surgically we had to keep him under regular follow-up after surgery, and 4 years post-op he's still doing good, and he comes regularly for follow-up. Appetite and all is good, his eating habits are good, and he's able to eat soft diet as well, and he's doing good. We are very happy because this was a nearly about 8 hours or 9 hours surgery in spite of a stormy post-op phase. Just because of a good teamwork and a committed effort from all the departments, we could save him and bring him out of this major surgery. And he's doing good. He's doing his things, daily routine regularly as he could do. We are very happy that he's a happy cancer survivor. Thank you.